Hello and welcome to ashford.com. You are watching an interesting video on what are the symptoms of mumps? How long does mumps last? Please read this disclaimer carefully. According to a new study conducted by health economists at the University of East Anglia and the Centre for Diet and Activity Research in the UK, walking or cycling to work is better for people's mental health than driving. Mumps is a contagious disease caused by the mumps virus. It typically causes painful swelling of the salivary glands. The mumps vaccine, developed by the American microbiologist Maurice Hillman at Merck, is one of the most common preventative measures against the disease. However, despite worldwide vaccination efforts, mumps continues to infect a significant number of people in developing countries and outbreaks occasionally occur in developed nations. There was a huge resurgence in the US in 2006. People at the highest risk of infection are young children who have not been vaccinated. Symptoms of mumps generally begin to develop within 3 weeks of infection. This is known as the incubation period. Most people experience symptoms of the disease, however, 15 to 20% of cases show no clinical evidence of infection, meaning it is possible to be infected without knowing. How long do symptoms of the mumps virus last? Symptoms of mumps typically last between 7 to 10 days, according to the U.S. Centers for Disease Control and Prevention. What are the signs and symptoms of mumps? The majority of people who become infected with the mumps virus, around 80–85%, will experience some of the following symptoms. Painful and swollen glands in the cheeks, neck or under the jaw, fever, headache, muscle aches, tiredness, abdominal pain, loss of appetite, pain, swallowing, dry mouth. What are the complications of mumps? According to an article published in the Medical Journal of Australia, known complications of mumps include spontaneous abortion, meningitis, pancreatitis, cerebrospinal fluid, pleocytosis, orchitis, ectodermal orchitis, when the male testes become infected, possibly leading to testicular atrophy, hearing loss. What are the complications of mumps? According to an article published in the Medical Journal of Australia, known complications of mumps include spontaneous abortion, meningitis, pancreatitis, cerebrospinal fluid, pleocytosis, orchitis, ectodermal orchitis, when the male testes become infected, possibly leading to testicular atrophy, hearing loss. References: